And we are going to deliver a Medicare for all single-payer system.
But what exactly is in his Medicare for All plan, and how will he pay for it? Tim Chapman, the Executive Director of Heritage Action, joins us now with more. Thank you so much for joining us this morning.
Yeah, thank you for having me.
So we just asked the question, so let's bring this up as we begin our discussion. A breakdown of some of what's included in this Medicare for All bill. Everyone insured. Nearly eliminates the private market, though. No out-of-pocket fees except for prescription drugs. No price tag, but higher taxes. So what do you think?
So you didn't have listed on there that taxes will be dramatic, right? I mean, this is a huge tax increase, number one. Number two, it outlaws 181 million plans that are out there right now that the American people are largely content with through their employer-based insurance. So we are now outlawing that and kicking people off those plans, forcing them onto a kind of one-size-fits-all government plan that squarely puts the federal government right in between individuals and the health care choices that they're going to make.
Yeah, and over 150 million Americans covered by private insurance through their employer. It would do away with that. We mentioned the cost of it. The projected cost, $32.6 trillion over the first 10 years. So how do we even pay for it?
You pay for it through much, much higher taxes. And so taxes on the American household, working class families across this country will be so significantly increased that it will be crowding out all sorts of other expenses in these individual families' budgets. And so, I mean, I just think that's the problem for Sanders right now, is that he's pushing a plan that he can't really articulate how it will be paid for and what that means for individuals. And I think he's very vulnerable on that.
Yeah, but yet we have 14 other Democrats co-sponsoring this bill, including 2020 contenders Elizabeth Warren, Kamala Harris, Cory Booker, Kirsten Gillibrand. Do you think that this would be enough to sway voters to their side?
I think, in fact, exactly the opposite. We just came out of the field with a poll that we did over the last week that was done in battleground districts across this country. It was done in 15 battleground districts. Most of these congressional districts are districts where Democrats actually won in 2018. And these are suburban districts and working class districts. And we found that there was 71% of respondents in those districts who opposed the issue of single payer. And then, furthermore, for independents, 66% of independents and 61% of suburban women opposed that. So I kind of think this is a third rail that the Democratic Party is now entering into, with trying to propose a completely federal takeover of the healthcare system.
You know, but at the same time, we had our Griff Jenkins earlier speaking with some people, you know, some random voters about their take on this, and overwhelmingly, you know, they support the idea, saying, you know, it would save money by reducing cost. That was a doctor that he talked to, that socialism in this form is necessary, that it would be best for patients. So why do you think, you know, some of these voters just aren't getting, you know, understanding the cost involved with this?
Well, I mean, I think because no one's articulating the cost yet. And I mean, right now, the Democrats, as you point out, are kind of tripping over themselves to endorse this in the primary because they are, you know, trying to impress their very liberal base. But like I said, when you get to the granular issues of what it takes to fund this thing and what it means for people's individual choices, and we believe, by the way, costs, we think this will actually end up making healthcare more expensive in the long run. When you get into that kind of stuff, people back away from it. It's like the first proposal is Medicare. People like the idea of Medicare, but Medicare right now is a system that's going to drastically change when you take it and you put every American in it and you do a one-size-fits-all approach.
Yeah, so when you get into the details of it, that's where some of the not-so-good stuff starts to come out. Tim, thank you so much for joining us. We appreciate your time this morning.
Thank you for having me.
Great.